Hi, I'm Carol Bender, nurse practitioner at Joy Wellness Partners. I wanted to give you some tips to help you have the best stellate ganglion block procedure. Thanks so much for signing up, and we want you to have the best results. You've already received your intake packet or will be receiving it soon, so please complete the information as accurately as possible so that the medical team can give you the best treatment. If you do take any blood thinners, definitely note that on the packet, but on your own, you should make sure that you stop taking it 3 days before the procedure so that we have the safety in place. Basically, any blood vessels that get dilated as a result of the stellate ganglion block in combination with any blood thinning medication could cause excessive bleeding or bruising. So please know that fish oils are included in this. Please stop fish oils, Coumadin, heparin, aspirin, any other blood thinning medications that you're on. If at all possible, please have a driver, but you can drive yourself home as you will actually be more appropriately reactive to any concerns on the road after the block. But we do think that it's a little more comfortable for you if you can have a driver. Additionally, please know that if you are coming for the block in the morning, afternoon, or evening, there is a possibility that you may not be able to swallow for 3 to 5 hours after the procedure. Not completely, but it may feel difficult. So we ask that you eat and drink a meal before you come for the procedure. And if you need a snack, just let us know when you arrive so we can provide you with some water, some snacks, and maybe even give you a hydration IV if that would be something that would be easier for you. Also notify in your intake packet, as well as again to your medical assistant when they take you back, of any allergies that you may have to latex or any medications, etc. We recommend that you abstain from caffeine, nicotine, or other stimulants for 24 hours prior to the procedure, but it's not a disqualifier at all. Definitely at least 12 hours post-procedure, you must abstain from caffeine and nicotine. It's important that there's no stimulants in your system at the time of the treatment. The same goes for NAD IVs, as they can be a little bit stimulating to your system. So we'll have no NAD IVs within the 24 hours before or after the procedure. Please let the provider know or the medical assistants know about any anxiety issues about injections or procedures or any disabling nausea that you may get with procedures, as we can give you anti-nausea medications or anti-anxiety medications. We will be putting an IV in your arm. It's just a simple way to access your vein if we do need to administer any medications. That'll happen at the office before your procedure. Please prepare to be at the office for over an hour for the beginning, middle, and end of your visit, which will include checking in. The medical assistant will take you back to the room and ask you some questions, and then the nurse practitioner, medical doctor, or registered nurse will put an IV in your arm, and then we'll move you into the stellate ganglion block room where you'll get that injection where you'll be laying flat on your back. The needle will go in on the side, either the right or the left, depending on which block, which number of procedures this is for you. There will be an injection of a small amount here, a small amount here, and then you'll be all done. They will be monitoring your heart rate and your pulse throughout the procedure, and they will be answering all of your questions before the procedure is underway. You have the full opportunity to wait to sign your consent form until you've been informed of everything that you may have questions about, and we are here to answer any of those questions as well in advance. Even if you want to email us or call us or text us, we are here to communicate, and we want you to feel like all of your questions are answered. They will also remove your jewelry from around your neck area and unbutton your collar so that they can access, and they'll have you turning your head to the side. The probe goes about this hard into your neck, as well as about this, this wide, and it'll go up and down your neck to find the stellate ganglion. So we also recommend that you keep us in mind, basically, if you're doing anything around, like, activity-wise before or after the stellate ganglion block. We don't want you to go into an anxious setting or into an uncomfortable setting right after the block, and we do want you to be able to go home or go to a safe place to relax and recover after the procedure. where there's less variables. So if you need to get a hotel room, we can recommend one that's connected and affiliated with our clinic. It's near the airport, or you can also stay with family or friends or reach out to us if we can help you in any way to answer questions about your accommodations. You will be able to speak through the entire stellate ganglion block procedure, and you will be alert and awake for the entire procedure. The providers will ask you how you're doing throughout the injection, and you'll be able to say that you're doing okay, so you don't have to be afraid because you can always communicate the entire time. The injection has been described by some as like a bee sting or a little prick and then it's done. So many people will tell us after the block that it was much better than they expected it would be. Most people, if they do report that it hurts, it's the ultrasound probe that's pushing on the neck to be able to see the stellate ganglion that might hurt the most. A lot of times people also mention that they feel that the buildup and the anxiety is worse than the block itself. So if you have a primary care provider that can prescribe you an anti-anxiety medication, then that can be something that you could use the day before as you prepare. Otherwise, we recommend using CBD oil. We have some if you need it, and doing other things like essential oils to calm yourself down and get excited for the procedure's results that are going to be provided as a result. We'll observe you after the procedure for a few minutes on the bed while we watch your heart rate and we watch your oxygen status. And basically after that, we'll move you into another room where you'll walk, maybe with a little wobbly walk as your blood pressure re-equilibrates. But then after a few moments, your blood pressure will equalize. You can sit, you can lay down. We'll have a room for you to relax while we wait and see that everything did as we expected. We do expect to see that red droopy eye with a little bit of a droopy pupil or a droopy eyelid, a little bit of a smaller pupil, and some people describe it as looking high on half the side of your face, depending on which side the procedure is done on. That's how we know we got the stellate ganglion block, because we have this Horner syndrome going on. That's the confirmation of a correct procedure. Please let us know if you have any questions about this preparation, and we really do expect that it will be less scary than you anticipate, and we're all here to root for you and for enabling you to get out of the trauma that you are feeling like you're living in. Or if you're doing this for performance enhancement, we commend you for doing what you can to detox your brain and also recover and be the most performing neurologically that your brain can possibly be. If you have any strange sensations after the block, please let us know as we're monitoring you. And then when you go home, you can definitely let us know. But if our clinic doesn't respond, please go to the nearest emergency room if you need to. After the block, we will be sending you an email at about 2 weeks to check in and see how you're doing. And you can always write back a yes or no if you'd like to have a special consultation or phone call with one of our medical team to discuss your questions further. Otherwise, we do find that at the 2-month point is when you can truly evaluate your success from the block. So we'll schedule a full-on phone consultation at 2 months with every person after the stellate block is completed, so that we can review how you feel, your post-PCL score, see the difference, and also see how you're feeling and what you've noticed. There's about 10% of individuals who the right side doesn't work for them, so they have to do the left side next. But each individual case can be discussed at that follow-up visit. Please let us know if there's any other questions you have, and we are so glad that you chose Joy Wellness Partners to have your stellate ganglion block in a safe setting today.